Hello, my name is Amulya Raghava. I'm a medical speech language pathologist here at Bangalore Baptist Hospital. Today, I will be talking about the facilities that we have to treat speech language and swallowing difficulties here at Baptist. Just to start off with, individuals who have had a neurological event like stroke, or individuals undergoing cancer treatment such as chemotherapy, radiotherapy, or surgical interventions such as head and neck cancer surgeries, or person diagnosed with long-term illness such as Parkinson's. All these individuals will have some or the other speech, language, and swallowing related difficulties. So depending on what conditions they have, their symptoms might range. So some of them might complain of lack of clarity of speech, or complete inability to speak, or difficulty forming a grammatically correct sentence, unable to understand what is being spoken to them, or swallowing difficulties such as coughing or choking while taking liquids, food getting stuck in the throat in terms of solids, or change in voice. So depending on these symptoms, we do the appropriate assessment and find an appropriate treatment plan. So when it comes to dysphagia, which is a scientific term for swallowing difficulty, not many places are doing assessment and management in this. But here at Baptist, we have instrumental and subjective and objective assessment that we do. So we have fiber optic endoscopic evaluation of swallowing, which is an endoscopic procedure. We will be inserting a camera through the nose, and at the level of the throat, we check whether the food is getting in the airway or is safely going into the food pipe. So another instrument that we have to look for swallowing disorders is videofluoroscopic evaluation of swallowing. It basically examines all stages of swallowing from the oral phase to the esophageal phase. So we ask the patient to swallow barium, and just like how we capture X-ray films, the same way we do this procedure. So based on these two procedures, what we interpret, appropriate treatment plan is given. The treatment could range from exercises to strengthen the muscles that have weakened, or maneuvers or techniques in which the patient can safely swallow. And in terms of stroke, we have aphasia, dysarthria, so we provide appropriate speech and language treatment. So the idea here is rehabilitation is extremely important. The earlier we start, the better would be the outcome, and regular ongoing rehabilitation is extremely important for a very good outcome. If any of you have any of these kind of symptoms that I earlier mentioned with respect to speech, language, or swallowing, any such difficulties you have, please come to Baptist and get yourselves treated at the earliest. Thank you.